Good afternoon slash good morning, everyone. For those of you who are just joining, we will get started shortly. We're just, as always, waiting for the audience to populate and start soon. Hi, everyone. If you're just coming on, we're going to start shortly. I'm just watching the numbers come up. I'm just kind of waiting for them to level off a little bit, and then we'll get started. All right, let's go ahead and begin. Hi, everyone. I'm Elizabeth Green. I'm the Communications Director at Big Cities Health Coalition. And before we kind of dive in, I just want to get a couple of housekeeping notes out there for you, and I'll put this in the chat as well. My colleague Brad Finegood and I are going to talk a little bit first. We will have a Q&A at the end. So feel free as you think of questions to go ahead and put them into the Q&A box. If you could please use that instead of the chat feature to do the questions, I would appreciate it. And because someone is always going to ask, we will send out the slides and a link to the recording after the fact. So yeah, I think we will go ahead and get going. Thank you for joining us today for our webinar, where we will discuss how we in public health and related fields can more effectively talk about drug use and homelessness. And by more effectively, I mean in a way that makes clear how public health work to address the overdose crisis deserves support from the public and from policymakers. So in a bit, I'm going to talk through some polling and focus group research that we've been conducting with residents of several dozen big cities across the US. But before we dive into those findings, we've asked our colleague Brad Finegood to set the stage a bit for why we're even asking this question in the first place. Why do we need to understand better how to talk about drug use and homelessness? Brad is the lead strategist for substance use prevention and response work at Public Health Seattle and King County, which is one of our member jurisdictions and one of VCHC's top advisors on these issues. So, Brad, I'm going to turn it over to you to give us a window into what you've been doing on the ground in Seattle and King County and how you've been handling media attention and public attention on this issue.
Thanks, Elizabeth. It's a pleasure to be here with everybody today. Again, my name is Brad Finegood. I use he, him pronouns. I work for Seattle and King County Public Health Seattle, King County, in working on overdose prevention and response. I've been with King County for about 10 years now, and I've worked in the field of substance use disorder for about 25 years now. I think it's really important for me to always lead with the fact that I'm the survivor of a brother who died of a drug overdose. So in addition to the fact that this issue is plaguing our communities and we need to come up with effective responses, this is a deeply personal issue for me, as I've been working on this issue for a long time, because it's really important, as we'll talk about today, when talking about our work, to really humanize the work, and make sure that folks know that we are leading with that human response, and that everybody out there who's struggling with a substance use disorder is connected to somebody, is somebody's kid, is often somebody's parent, and is related to somebody. So we'll start with talking a little bit about data and what we've been experiencing. And I think, everything I'm going to talk about in our little bit of time today, I really want to lean into the fact that this is often a hyper-local issue. And so what is happening in the communities is different here in the Seattle area than different in Baltimore or Detroit or Chicago or Los Angeles. And so really being able to have access to some hyper-local resources is really important. And what I'll talk about today is really what we've been doing in Seattle and King County. You can go to the next slide, please. So it's really, when we think about what's been happening, it's important in public health to be able to lead with data about what is happening to tell the story. This is from our overdose dashboard that we have. And so folks could access this in real time. It's a real-time overdose dashboard. And so a couple of things I want to point out here today is that, we started to see a really exponential increase in overdose deaths at the time, right about the time COVID started. We started to see fentanyl come in our community. In the West Coast, we were much later to see fentanyl come into the community than on the East Coast. And there was this perfect storm with COVID, with the shutdown, and with a really new supply of fentanyl coming in the form of counterfeit pills. And so as you can see, the amount of people who were suffering overdose deaths continued to climb exponentially into the third quarter of last year, where we hit a really bleak peak, if you will, of people who have passed away. But you'll also see that when we're looking at year-to-date counts of people who have died of an overdose, and we know that this is partially true across the country, is that we're starting to see a very significant decline in overdose deaths. And the truth of the matter is that it's probably multifactorial about why there is this decline. So in King County, because we're able to see data in real time, we know that there's been about almost a 25% decrease so far this year in overdose deaths. And so being able to articulate, when we were talking about this issue last year, is a very different way to talk about overdose deaths, because we didn't know when that curve and that trajectory was going to peak. But now, as we're communicating about what's happening in the community, we can start to look at, the fact that there may be some hope on the horizon, and what are some of the things that we're doing that we think is impacting overdose deaths. You can go to the next slide. Again, in public health, we need to be able to look at the data, and we need to be able to look at and think about how our interventions impact marginalized communities who are suffering disproportionate levels of overdose death. So here in this slide, a little bit tough to read, but basically the gist of it is that people who are, according to the medical examiner's office, people who are living outside, or people who are in some type of supported or supportive housing make up about half of our overdose deaths. So that is about 1% of our overall population, making up about half of our overdose deaths. So this is a really important point for us, because this it's really obviously humanizing the issue and talking about the nexus about people living unsheltered and the impact of and the importance of housing folks. And it could also be spinned in a really different way, in a real negative way, stigmatizing those who are suffering with substance use disorder, who are also living outside or in the housing service sort of trajectory. Other groups of people who are marginalized and have a disproportionate amount of overdose deaths are communities of color. And so being able to raise that issue and the disparities that are existing in our community is really important. And when we talk about how we're addressing this overdose crisis, really using some targeted universalism and really focusing on those populations that have disproportionate outcomes. Next slide. So when we talk about our role and our work in addressing overdose, I think it's really important to think about the full continuum, right? We talk about our role in public health, and here you will see our vision and our mission at Public Health Seattle King County. But I think it's really important to talk about the full continuum, because it's really important for folks like to understand that harm reduction is an essential key in the continuum. It's not the only thing, right? It is not, we need to get naloxone out there for folks to keep people alive. We need folks to be able to test their substances so that they can make educated choices. We need folks to be able to use safely so that they don't die and that they can be connected to services. We need open locations for people to come in and drop in so they can be connected to community and connected to people to provide help. We need syringe service programs to keep from other types of transmissible diseases and infections from being transmitted. And it can't be the only thing. I think about an adage from one of our longtime harm reductionists in our community who came up to me and said, we want to expand harm reduction programs, but if you don't get people onto treatment medications when they want treatment medications, then you're a complete failure. And so really thinking about the whole continuum is really, really important. Next slide. So when we think about that, we think about our work across the continuum. So our work in public health, and our work with community providers and in other areas of government for us, which is for our partners in behavioral health. So, we have done a lot to be able to identify roles and responsibilities, but to be able to articulate that clearly to the community that we are not just a one-stop shop for one thing only, that we want to provide pathways for people to get into recovery and to start the recovery journey, and that there's many different access places for people to start the recovery journey, whether that is in a syringe service program, whether that's in a housing provider. Our detox cannot be the only place that people start the recovery journey. And so being able to share work across the spectrum to be able to articulate the whole continuum of services has been integral for us when we've been talking about our work and being able to relay our work to the community. So we can keep going. So earlier this year, our county executive, Dow Constantine, sort of announced a county-wide strategy to addressing overdose prevention. So one of the things you'll hear from Elizabeth later is that we have to, when we're talking about our work, and not just when we're talking about our work, but when we're doing our work, have some short-term things that we're operationalizing and some long-term answers that we can provide a vision for people of what's going on in our community. So what's our short-term response and what is our sort of our long-term way to address the issue and provide more access to treatment and services. So our county executive made an announcement, a multi-sector, multi-department strategy that basically came up with 5 priorities and 13 actions that the county was taking to address overdose prevention, all the way from expanding naloxone and vending machines to our 24/7 buprenorphine line to expanding access to residential treatment for people so that folks could see the full continuum of what we were trying to build out, lowering barriers, access to care, improving things like crisis services. So I'm going to read you a quote real quick from one of the reporters that came out after we had this announcement about what our actions and our steps were. So the reporter said, so there are long-term efforts underway. Voters recently approved funding for our new crisis care centers, which about lowering barriers and easier access to care. And work is being done at new residential hospital for treatment. But both of these efforts are still at least months away. Today, county officials talked about work being done right now to save lives. So when we're being able to talk about our work and being able to relay our work, it's about the short term, it's about the medium range, and it's really about the long term. Next slide. So this slide just talks a little bit more about the actions that we've taken, and we've used social media. We also have a public health blog that we've used to show some of our success stories. So in addition to the data about what's not happening and what's going wrong and the planning, we often report back on those metrics that we're able to track. So we've been able to send out 45,000 naloxone kits and 100,000 test strips. expanding access to both naloxone and buprenorphine, and methadone in different areas and different locations, bringing services close to people, and improving our workforce. So really taking what the community has told us about what they want to see and being able to work on that and show the community back that we're working on this. Next slide, please. So with that, I think for me, it's been really important to also, over this last 12 months, to think about like what is a vision for Hope, and for people being able to understand and see what the vision for our system of services look like. So it goes from everything to expanding access to harm reduction, to access to medications for opiate use disorder in a lot of different ways, to lowering barriers to the front door. So people want to see that people can get access to treatment and access to services without barriers, because our community unfortunately has experienced a lot of barriers, and that front door looks wide open and we're going closer to people. And then bringing that back with the data. As you can see, we've doubled the number of people who have accessed medications for opiate use disorder. Next slide. And lastly, I just want to say that I think the most important thing is really around mobilizing community. We know that in public health, we can't do this alone. Our slice of the pie in addressing overdose is super duper small. There's so many social determinants of health that go into people's traumas, that go into what's happened with people. So we have to be able to mobilize community, bring community together, to really actualize what our plan is, so that the community can see what we're trying to communicate. Thank you, Elizabeth. I'll send it back to you.
Great. Thank you so much, Brad. So now we're going to jump back up to the 30,000-foot view to see how city residents across the U.S. respond to how we communicate about the overdose crisis. So as a quick intro to where we are coming from as an organization, the Big Cities Health Coalition was founded a little more than 20 years ago to provide big city health commissioners and their staff with a forum to discuss public health issues and strategies that are unique or at least unusual in large urban environments. And our members lead the largest urban health departments in the US, and they serve about 1 in 5 Americans. We apply a health equity and racial justice lens to all of our work. In fact, we began this journey in messaging research last year when we did some polling and focus group work so that we could get a better understanding of how to talk about public health and structural racism and the relationships between them. One of our key findings was that we get more traction talking about racial inequity if we frame it as a human-made problem that we can fix. We know from this and other organizations' comms research that framing your messaging with shared values and laying out clear evidence-based solutions are effective. So that brings us to more recent research. Now, what we started to see a story develop in the media and on social media that big cities were failing to address the overdose crisis and other kind of related issues. So we decided to investigate further. And what we knew when we started this project was that harm reduction strategies and other public health approaches to the drug overdose epidemic, they work. But we were also hearing some resistance to these strategies from the public and from policymakers, or at least some of them, some of whom claimed that these strategies were enabling drug use or were ineffective. And some of these negative messages were buoyed by some negative media and political narratives about cities in general. So that led us to ask, how could we talk about public health approaches to overdose in a way that persuades more people? So let me give you a quick overview of how we conducted this most recent research. We worked with the polling firm Hart Research, with whom we've collaborated on previous messaging work, and we wanted to talk to people across all of our member cities. So Hart conducted the surveys and focus groups online. We started with an online survey to get an understanding of how people feel about their cities and what issues are most top of mind for them. And then we held 4 online focus groups to dig deeper into their attitudes and the language that they use about overdose and homelessness and crime, which were some of the issues the initial survey showed that they care the most about. So based on what we learned from that, we worked up some messaging, and then we surveyed again to test those messages to see how they landed. I'm not going to take you through every nook and cranny of the research today, but I do want to share some highlights. And we're going to send you a link to more details that are in our published playbook. And you will receive the slides after the webinar so that you can dig into the results in a little more detail. So our respondents, just to give you a quick overview, were a representative cross-section of the communities that we polled, which were the cities, again, that are members of the Big Cities Health Coalition. And really, I'm not going to kind of dwell over the details, but just take my word for it that this is a representative sample of what city populations look like. And if we look at the next slide, similar point can be made about um, the education and income and political ideology kind of makeup of this group. This is representative of what big cities look like as a whole. So let's start with our key takeaways from this research. First, what was really interesting was that more than half of city residents actually see their cities as thriving, but all of them see crime, homelessness, and drugs as big issues that they want their city to address. I say all, the vast majority of them see these issues as big issues that they want their city to address. So there are two parts to this. First is the perhaps more surprising piece that the majority of big city residents see their cities as thriving. Already we begin to see that what we might call a failed cities, quote unquote, narrative is not the story that's told by most people who actually live in them. And if we look at the second half of this sentence, we see that regardless of their feelings about whether their cities are thriving or declining, city residents are almost universally concerned about a trio of issues that they see as intertwined: crime and homelessness and drugs. So let's explore this in a little more detail. We see that 54% of the people that we polled see their city as thriving and successful. And when you add in how many see their city as kind of being a mix of thriving and declining, you've got 70% of residents having either a positive or at least a mixed view of their city. Now, an interesting side note to this, there were, of course, regional variations on a lot of these questions, and this was one of them. We see especially optimistic views of cities from Texans, men over 50, and Democrats. And on the other hand, residents of San Francisco and Pacific Northwest cities tended to be more pessimistic than average about where their cities were headed. Sorry, Brad. And here's a closer look at some of the data on how these people perceive the issues in their cities. We found it striking that for many, these are issues that are not just in their city, but in their own neighborhoods as well. So what you see here is that the little figures that are in darker green are the folks that see these as issues in their own neighborhood. The lighter green is, kind of widens out to, yeah, it's not really in my neighborhood, but it's definitely in my city. And the very lightest green, very few people don't think it's really an issue at all. So one important takeaway from this is that there is deep concern about crime and homelessness and drugs, but that does not necessarily equate to a belief that their city is in decline. I think people often think that those two things go hand in hand, but there are clearly a significant portion of people who see these as big issues, but also see the future of their city as, thriving and doing well. So you can hold both beliefs in your head at the same time. So that takes us to key takeaway number 2. What do city residents believe are causing these problems that concern them so much? What do they believe are the causes? And our research found that instead of pointing always to individual bad choices, quote unquote, as the causes of these issues, people actually largely blame systemic problems, especially they point to housing affordability or the lack thereof, inflation, and mental health as core issues that really drive the problems that they see in their city. So here's a closer look at some of that data around that question. We asked people what they believed were the major causes of homelessness and overdose and crime in their city, and these were the answers that rose to the top. Unaffordable housing was the main thing that they mentioned, high inflation and cost of living, the US mental health crisis, a lack of permanent housing solutions for people who experience homelessness, and not enough funding for programs to help people who are struggling. However, and this is an important however, there are still a significant number of people who also blame individuals for why these problems exist, whether it's them not being willing to get help, as some people said, or not having to face consequences for their actions, as others pointed to. So in other words, city residents are on board with fixing systemic issues and see these as crucial causes of the problems that their cities face. But that's not to the exclusion of, seeing policing and getting individuals into treatment as like they also see that as an important use of their city's priorities and budget. So it's complicated. Still, when we ask people about solutions to these crises, and make no mistake, they do see these issues as crises, a majority of residents prefer solutions that work to fix the underlying problems, the kind of work that public health does all the time. So in our poll, instead of focusing on specific solutions like naloxone distribution or housing first policies, we really asked more broadly about whether people preferred, on the one hand, solutions that quote unquote get tough on people who use drugs or experience homelessness, or on the other hand, whether they preferred solutions that fix the foundations, that is, get at the root causes. And we described to them briefly what this meant, and here's how they responded. So we see if we ask about city issues overall, 69% will say they favor a fix the foundations approach. And then the numbers get even more dramatic for if we specify whether we're talking about homelessness or drug addiction and overdose, then you really see the vast majority of city residents are pointing to a fix the foundations approach, a getting at the roots of things, a social determinants of health approach, a public health approach as the right way to predominantly approach these crises. So it is worth noting that a majority prefer to get tough approach for crime, which makes these numbers for homelessness and overdose that much more striking. The focus groups in particular highlighted how much empathy city residents feel for people who are using drugs and experiencing homelessness. Many people, in fact, are experiencing firsthand how costly housing is, how unaffordable other necessities are because of inflation, and how hard it is to maintain one's mental health. These are things that a lot of us are going through. This is not like there's a lot of empathy around those issues. So they get it more so than ever before. And they don't want people who are using drugs and experiencing homelessness to be treated like criminals. Okay, so how can we learn from all this? How can we learn from what city residents tell us about what they see in their cities, what they see as its major problems, what's causing those problems, and how the city should solve them? What does all this tell us about how we can more persuasively message the work we do to this audience? So that brings us to our last key takeaway. We, as I mentioned, tested a variety of messages based on what people were telling us about their beliefs and attitudes. The message that tested best acknowledges the feeling of crisis that city residents have around drug overdose and homelessness, and also points out both the short-term and the long-term benefits of investing in public health solutions, like Brad mentioned. So let's take a closer look at the elements of this winning message, the one that tested the best with its audience. So I'm going to read it to you first in its entirety, and then we're going to kind of pull it apart a little bit to see what works. So this is the message. Our city is facing interlocking crises of homelessness, drug overdoses, and mental health. We all want healthier and safer communities. So we need both short and long-term approaches. Short term, we must invest more in and expand access to effective treatment programs. Long term, we must continue to make housing more affordable and create more better paying jobs. So what's most important here is really not the exact phrasing, but rather the core elements and why they're here. So let's take a closer look at those core elements. So first of all, one thing we're doing here right at the outset is acknowledging that residents feel their city is facing a crisis. And this was a little surprising for us because oftentimes you hear in public health that we claim too many things as a crisis, that people are getting crisis fatigue, that it kind of puts us at risk of sounding like the boy who cried wolf. The difference here, I think, is that we are not trying to persuade these people that we're facing a crisis. They already believe it. So in that case, it's better to acknowledge that belief and then move on. So another core element is acknowledging and reinforcing the relationship that people already see between these crises. You don't have to name every problem. There's a lot going on that kind of is all entangled up together. Instead, you can focus on those that public health can play some part in solving. So then we shift the conversation away from crime and any kind of divisive rhetoric and emphasis on policing that often accompanies conversations about crime. Instead, we're going to shift to envisioning community safety, a goal that we all share, and what it takes to get us there. Now, we've seen that city residents are impatient for progress now. This is where the disgruntlement comes from. They want to see progress now. And they also agree that longer term investment in fixing the foundations is the only lasting way to solve these issues. Another two things that you can hold in your head at the same time. You can believe that something needs to happen right now, and you can also believe that it is worth investing in longer term strategies and that those deep structural issues are actually what's going to solve the problem. So we need to be talking about both. Show them the data that your short-term solutions are making a difference, that they work, that you have been making a difference in your community, and also show them the evidence that more structural change would make even more of a difference. So talk to them about a specific solution that is already working. You don't have to discuss treatment programs. We mentioned this here, but it can be whatever is working in your community. It just needs to be something that you can show has had some results in the short term. And then you advocate for a couple of evidence-based longer term solutions. If you have time, show some of the evidence that these programs or policy changes work, even if it means pointing to a different locality, right? Like this has worked in another community that is similar to ours. Let's do it here. The solutions don't have to be solidly within public health's purview. In fact, most true long-term solutions to these crises will require collaboration with other local government agencies, community-based organizations, private sector or entities such as healthcare organizations. Talk about the work you're doing to collaborate with these institutions to get real, lasting change done. Now, that is just one tested example of messaging that that works to persuade a movable middle, as we sometimes like to call them in messaging work. Now, in the slide deck that we're going to send out after the webinar and in our messaging playbook online, we've spelled out some general principles that you can use to craft your own effective messaging that is specific to your community. But for now, I'd like to move over to some questions from you. And I know we've got some that have been that you've submitted to us in advance during the registration process, and then we've had some come in through the Q&A. So we can go to questions.
Hi, everybody. My name is Walker Irving, and I help out the team at BCHC. And so I will be going through some of the questions that we're seeing here. So the first question is, let's see, there was one here that related. Okay, how can you change your messaging for conservative versus progressive audiences?
Yeah, so that's a great question. And I think one of the details that I didn't go into about our research is that when we kind of did the initial survey of our city residents, the polling firm that we worked with very usefully kind of divided everybody up into some core groups of people that, you know, kind of generally share some beliefs. And so there were 5 groups altogether. And, you know, they basically said, you know, we've got a couple of groups that are really already on board with what public health is trying to get across. And we've got a group that you're probably not going to persuade. Like they're just in a very different place in terms of their core beliefs and core values and the kind of strategies that they think are going to work. However, there were 2 groups in the middle that were not really entirely on board for various reasons, but were persuadable. And that's what I mean by the movable middle. That is often when you see this kind of messaging research, they will talk about that group of people. When you look at when they're talking about the election, for example, this is a perfect example where they'll talk about like wanting to win over independents, right? The people who are kind of in the middle and undecided and could go either way, but you have to do the work of persuading them to join you. So I think that's really where you want to focus your energies. That is the most efficient use of your time, is not to try to win over the people who are spreading misinformation or who have firmly planted their feet in the ground against what you were trying to do, but who actually have some empathy for what people who are in danger of overdose or who are experiencing homelessness, what they're going through, but really are impatient to see some immediate solutions and are really kind of fed up with what they see going on in their cities. Those people can be persuaded, and it's worth spending the time to do so. Brad, I know you've got a very sort of diverse community in Seattle and King County.
Yeah, what I would say is that some of our staunchest supporters come from, I mean, they come from both sides of the aisle. One of the things that I always try to keep in mind is people have been impacted by addiction, not just overdose, but like addiction of all sorts, in many different areas. And the stat that comes to mind from Rand is that 42% of people know somebody who's overdosed, right? And so, this is, although there is a tremendous impact on communities of color and those living unsheltered, there's the impact of overdose and addiction runs wide. And even with those who are, I'll say on both sides of the aisle, is I think the one thing that I found from my personal experience is everybody wants to help people, right? And so, but understanding, what folks are willing to do is really important. And I'll just pivot to a comment that's in the chat and my apologies if I pronounce any names wrong, but that Kelly put in the chat around sharing stories of those in recovery, right? I think that that's really, really important. Because it's not just like a traditional path to recovery, right? We're starting to do more around sharing stories around people who have accessed resources and services at harm reduction locations, at syringe service programs, at outreach programs that now have a story to carry on and to give back. And so really to humanize that work, and just know that folks who you're talking to, often they'll having individual conversations with people, is really important to be able to understand people's connection to the issue, because it's rare that I find somebody who doesn't align with some of the research that has came out of the BCHC, which is that people see this as a health condition. I think we've done a really good job of changing the framework of people who are struggling as criminals, and that the criminal legal system is going to have a positive impact. I think there's just a lot of stories that can be shared. There was a comment about sort of local move to that of criminalizing and arresting people and who are living outside and using drugs publicly. I think one of the things that I really think about is the metronome, about how we are in such a deep criminalization state, pre-COVID 10 years ago, so much of it swaying one way. And one of the things that I think is that we as a system need to build part of a system to respond to that, right? And we need to be able to listen to constituents. We need to be able to listen to our community, but we really need to listen to people who are out there struggling about what they need, right? And being able to provide access to those services. I do think that like people using drugs in public has been a real struggle because our systems are not really set up to provide a lot of supportive services to those folks. And so we have to also think about, and this is part of that communication strategy, but it's really about our overdose prevention strategy, is providing that vision for folks about the system of care that we're trying to get to.
Okay. The next question is, how granular do you recommend getting about the solutions that you're talking about? Is there an appetite to learn about what public health treatments actually mean or look like for public audiences? It can feel vague to paint the solution as just public health or better treatment, but sometimes people might not want to know more.
That's an interesting question. I think that very much depends on the situation and the audience. We definitely saw in the focus groups, as we kind of talked to people at a more granular level about these issues, that there was a real appetite for some details that people really wanted to see. They wanted to understand what their city was doing and wanted to know more specifics about, what are we doing and why does it work? And why aren't we seeing the effect of that immediately? So I think there is an appetite to better understand some of the more granular details and some more information about why it takes a while for some of these strategies to work, what it really takes. And I think one thing you can kind of play off of here is this deep empathy that people feel, this a deeper understanding of what it's like to be that close to a crisis. I think people better understand now the deeper roots of these issues so that they can better understand why a more cross-cutting strategy that isn't just about like saving people's lives from overdose with Naloxone, but that there needs to be more than that. Like this, there really needs to be a kind of um, a more cross-cutting set of strategies to address the problem. Brad, I don't know if you've got some thoughts on that.
Yeah, I mean, I think you said it well, right? How granular you get, like, depends upon like, what you're interested in putting out there, right? Like, the more granular you get, the more questions you get, but it's really important to show the successes, right? Like, for me, in order also to paint the picture, and it's not even painting the picture, but to demonstrate what's to come, there needs to be some level of, like, you got to get granular. And I'm also a firm believer in being transparent with the community when we, in places of privilege and positional authority and in government, we have to be transparent with the community, and we have to be able to answer the hard questions, because that's what people want to know. And especially, when we're asked from communities that we haven't served well in the past and that have been impacted by the war on drugs, especially Black and brown communities, when we're not granular with what we're trying to relay, then that just adds to the inherent distrust. So really, laying out what it is you're working on and being able to show from like short term to long, I can't tell you enough about how important it is for people to be able to know that the work that you're doing is you're wanting to impact, and we're trying to impact overdose in the short term, but we're also have a long-term vision about, how we can, get people into a care trajectory. I'll just, there's a bunch of questions about criminalization can I touch on that, if that's okay?
Yeah.
Yeah.
Right. So this is obviously a hot topic. It's a hot topic, especially on the West Coast. We're dealing with it here in Seattle. There's some law changes to criminalize, especially public use. We've seen it in California, in Oregon with the repeal of 110, right? I just go back to the fact that, to me, this, I think a lot about our care system and how our care system has to evolve, right? And so really, when our care system doesn't evolve, like, it leaves folks in a struggling position. Our drug supply has changed and become so toxic so fast that policymakers often don't see another concrete, tangible response. I think folks that wasn't their first inclination to use the criminal legal system, and I think we have to be able to provide a viable alternative. When I've talked to law enforcement officers throughout time, fire departments, first responders, most times they don't want to take somebody to jail, because the vast majority of time, people are back in the same situation fast, right? They're looking for answers just like we're looking for answers. And so I think it's really important to understand, as the messaging sort of research has told us, like, why is it that, like, people are leaning into the criminal legal system? And it's often because there's no other, like, response system. And so what our responsibility is, in my opinion, my responsibility is to be able to think about crafting what that alternative response system is. Is there other places, alternative transport, places for alternative transport? We're developing, you know, a post-overdose receiving center. We have crisis care centers. So I think it's about when your policymakers are looking for answers, being able to come equipped with answers. It's about like mobile methadone clinics, right? It's about naloxone, you know, other ways to get naloxone out. And so I think it's really important that we have alternatives that we can put out there. I'm not funding much of this. What it is it's like, where does our system need to go, and being able to articulate that in a comprehensive manner for folks to be able to implement.
Yeah, and I think just to piggyback on that, you know, I mentioned in my part of the presentation that, you know, it's effective to shift the conversation from crime to community safety. And I think that's what Brad is talking about is a perfect example of why you want to do that, because a lot of times folks are used to talking about their concerns about public safety strictly in terms of crime. And if we allow that to continue, then we're not really focusing on the long range kind of systemic strategies that we need to do to make people feel safe, which is really what they want, right? Like they're actually incorrect that there is more crime in their cities. Crime has been either, you know, leveling off or going down, depending on where you're, especially violent crime. And so they're incorrect about the increase in crime in their cities. What they're actually talking about is that they don't feel safe because they're seeing the impact of the overdose crisis and the impact of houselessness on their cities. They're seeing it visibly on the streets. And so how do we get to a point where everybody can feel safe in their community? That's where the conversation should be. It shouldn't be about crime.
Okay, the next question is about public health funding. So how do we talk convincingly about the need to invest in fixing the foundation's public health approach when it feels like funding is constantly diminishing and potentially competing with other issues like middle-class folks trying to stay afloat despite rising costs, families struggling to find and pay for childcare, etc.?
Yeah, that's a great question. I mean, I think one of the reasons why we were I think one of the things that was really encouraging to us about the results from this particular round of messaging research was that we saw a clear mandate from city residents for more investment in public health strategies. And so, you know, it's a long road to make that point stick with the people who actually provide the funding, but the mandate is there. You know, one of the slides I didn't show is that a large majority of city residents say that city governments should have responsibility to deal with crime and homelessness, and a majority say that they should also be dealing with drug addiction and overdose. And the vast majority of people think that their governments are not spending enough on these issues. And so, you know, we see this as a policy leverage tool to be able to make the case that, look, your constituents want you to do this. The numbers are right here. So again, that doesn't necessarily mean immediately everybody's going to flip the switch and say, oh yes, we should definitely be investing more in social services, but at least we have some of the numbers to be able to back that up.
I mean, I'll just add that I think, you know, going back to how everybody's impacted by this issue in different ways. And that, you know, some of our biggest supporters have been the business communities in Seattle, because they want answers like public health wants answers, right? And so thinking about how do you come alongside community members who have maybe different interests and different seats at the table. Our hospitals want answers because they don't want you know, Friday nights to be you know, inundated with folks who are really struggling. And so, you know, recognizing that there is a community need for, you know, alternatives to help people. So bringing people to the table who have different interests and aligning those interests in common goals, I think has been really helpful here. It's not the perfect answer and it's not the perfect solution, but I think that that's really helpful. Can I also talk a little bit about one of the questions about upstream prevention?
Yeah.
You know, I mean, one of the things that we know is that really trauma impacts people's, behavioral health, right? Whether it's their mental health or whether it's their substance use disorder, and that, traumas are the biggest impactors. And so the more that we can, work on addressing social determinants of health, I think that that's really important. Things like systemic racism, stuff like that is really important. The other thing I'll say from somewhat of from a prevention lens is that I think it's really important to be able to communicate risk, right, to youth. I think one of the things that we saw when we first started to see fentanyl come in the form of counterfeit pills is people perceiving that there was a low risk to using fentanyl because it came in the form of pills. You didn't need to inject it. You could smoke it, snort it, or swallow it. And then we started to see a lot of younger people impacted. And so really what some of the things that we've been able to do is get information out to the communities around risk, real information, not scare tactics, but more information, and really listen to the community. Again, listening to I think for me, the underlying lesson of today is listening to what the community is asking and really understanding what youth are asking, which is like, I know youth who are struggling. What do I do? And so being able to provide those resources, whether it's national resources like the 988 line or other types of local resources, I think has been really helpful, because we know from our Healthy Youth Survey that the risk perception is much more in line with what the risk is, and that youth's substance use of hard drugs is less than it was a number 4 or 5 years ago. And so really leaning into that would be really helpful, is really helpful.
Yeah, and I think there's some real support in this messaging research that we did for it's very clear that city residents already understand social determinants of health. They don't use that terminology, but when you ask them, that slide that I showed earlier, when you ask them, why is this happening? The top 3 things that they mention are housing and unaffordability, inflation and cost of living, and mental health crisis. Like they get it. They understand that there are these deeper causes at work. And I think for somebody who wants to kind of pull the effort back upstream, like public health does, that's really encouraging news, right? Like you're already starting on fertile ground, that people understand that we're not going to we're not going to treat our way out of this. We're not going to arrest our way out of this. We've got to back way up and deal with some of the more systemic issues that get us here in the first place.
Okay, I'm gonna go to some of the questions we got from registration. So one question was, how do we balance using destigmatizing substance use disorder language with speaking in plain, understandable language with the public?
I loved that. I saw that question in the when Walker sent me the list, and I was like, oh, that's such a good question. And I say it's a good question because it's really hard. It's one of the things that we talk about a lot is, how do you, and in fact talked about a lot in the design of the surveys for this research. You can talk in a very particular way that is 100% destigmatizing, is professional public health language. And oftentimes, like if you trotted that out in a survey, people would just blink at you like, what are you talking about? That is not, like, people talk about addiction, not about substance use disorder. They don't use that terminology. And so, we kind of went back and forth about how do we talk to people in a way that makes sense to them without completely losing our principles and contributing to stigmatizing language. And that is a really fine balancing act to walk. And I think what we kind of landed on, I don't think we ever like explicitly described it this way, but I think what we landed on was that there were certain times where the terminology just is the way it is, and that's the way people talk, and we're going to go with that to some extent, but we are also going to balance that with some genuine discussion about the the fact that the people going through this are people and need support. And we are, a community that works together to address these issues. So, I mean, I think there's a way to balance that out, but it's definitely a sticky subject.
Brad, did you want to add anything to that?
I mean, it is really hard, right? Like, I think you also have to acknowledge the language that people use in their own communities and honor that too. And I think it's also important to be able to say, this is the reason why I use this language. I'll talk to folks and I'll use the terminology substance use disorder. And they're like, why do you use that word? Why don't you call people addicts? And being able to take the time to explain, in addition to the fact that like it's accepted terminology or whatnot, like people are out there struggling with a condition that we know that that can be treated, right? And that what labeling somebody means. And when I'm in community with people who self-identify in a certain way, far be it for me to counter that, right? And I know somebody just put in the questions and answers reporting on addiction.org as a sort of collective resource. I think the way that the media portrays things and anything that we can do to help educate folks, I think really, really important. Walker, can I address the open question that Sarah had in there about Narcan real quick?
Yeah.
So I think this is a really hard and obviously really real about the notion that Narcan enables people who use drugs to keep using. And I think that that's why it's really important to paint the picture, to understand that Narcan is just one piece of the puzzle, right? Like we have to keep people alive. And then we have to also, that's the short term, right? And then it has to be the medium and long term that we have to provide access for people to get on a recovery trajectory. The other thing I'll say is that we need to empower people who have lived experience to be able to tell their story. So I know and have a number of people that I work with who have talked about naloxone use that has kept them alive and has kept them alive a number of times before they went on the recovery journey. So being able to use those lived experiences, I've often been asked about kids at parties, and my retort is that like, I have kids, and if my kids are going to a party, I darn well hope that they have naloxone or Narcan on them, because if one of their friends suffers an overdose, I want to make sure that one of their friends don't die when that can be reversed. And so, being able to sort of humanize that story is really, really important. The other thing, there was a question earlier about supporting people with lived experience. And I really think that this is really important just to touch on before we jump off, is that, we really have to support people with lived experience, and especially when when they tell their story and they use their story for good, because it is really difficult, and sometimes that will get turned around on them. We've had incidences where that's been used in a really bad way by other people, and we really have to support people. We really, in order for us to espouse our trauma-informed values, we have to provide that internally to our colleagues and coworkers and community members.
Okay, great. Thank you. I think we will have to end it there just to be respectful of everybody's time. Elizabeth, I will hand it back to you to close out.
Great. Thank you so much, Walker. I really appreciate all your work to keep the ship running smoothly. And thank you so much, Brad, for joining us today. We always appreciate your partnership. And thank you all for joining us in the audience today. Like I say, we will be sending out the slides and the recording from this shortly after the webinar ends, and a link to the longer playbook, and would encourage you to keep following us for more information about messaging research, and would love to hear your feedback about the webinar and any of the ideas we presented today. Thank you all for joining us. We'll talk to you soon.